Hello everyone, welcome to GS Booster Short, your daily dose for GS preparations. In our today's lecture, we are going to understand about the initiatives taken by the government towards the health sector. We are also going to cover up through this very lecture Prime Minister's Ayushman Bharat Health Infrastructure Mission, which has recently been launched by the Prime Minister in Varanasi. However, let us see the context first towards the health challenge in our country. For long it has been felt necessary the need for ubiquitous healthcare system. Yes, so recently there was a survey by Lokniti CSDS in 2019, and through this very survey it was sought to map the availability of healthcare facilities in our country. This survey found that although in 45% areas one can approach or have access to healthcare facility by walking, whereas in another 47% area an individual would require transport. Then there is asymmetry between availability of healthcare facilities in urban and rural areas also. Naturally, it is found that in rural areas access to healthcare facilities was more difficult as compared to urban areas. Now, coming to Prime Minister's Ayushman Bharat Health Infrastructure Mission. Now, given the COVID pandemic, it was realized that there are certainly various gaps in our health infrastructure, and therefore it was time to do something about it. So this very mission basically focuses on strengthening healthcare infrastructure across country, and it will be in addition to National Health Mission. When we say that it will be in addition to health mission, National Health Mission, we can understand that then these schemes are not overlapping. There will be different funds earmarked for both of them. The main objective of Prime Minister's Ayushman Bharat Health Infrastructure Mission is to fill critical gaps in public health infrastructure, especially in critical care facilities. In the time of COVID, we found that the critical care facilities were in short supply, because of which a lot of people had to lose their lives. Now, under this scheme, there would be an increased focus on diagnosis, surveillance, as well as integration of data between various states and UTs with respect to this very data which is generated by diagnosis and surveillance of disease. Why is it necessary? Because it has been realized since COVID pandemic came as a very big challenge for the healthcare infrastructure, and this is surely not the first epidemic that we are going to go through. With the proximity of coming of human beings to the natural environment today, and with the degradation of natural environment today, we have become more proximate to pathogens, and therefore there is every likelihood that in future we may come across different sorts of epidemic or pandemics. And therefore this very system under Prime Minister's Ayushman Bharat Health Infrastructure Mission, it envisages creation of testing facilities at every level, be it the district level, be it the panchayat level, or be it at the state level. And through this, basically an IT enabled disease surveillance system through a network of surveillance laboratories at block, district, regional and national level would be established. The public health labs will be connected through integrated health information portal, which will be expanded to all states UTs. So, why is there a need of this expansion of this integrated health information portal to states and UTs? Because when a health epidemic comes in, it does not impact people of just one locality. Every people, especially within the country in which there are no borders as such, everyone is susceptible to this such very disease. Then, so the mission aims at ensuring robust system for detecting, investigation, preventing and combating public health emergencies and diseases outbreak. And इस चीज़ को facilitate करने के लिए a number of laboratories and institutions would be set up, such as National Institution of One Health, 4 National Institutes of Virology, regional research platform for WHO's South Asia region, 9 biosafety level 3 laboratories and 5 regional centers of disease control. Therefore, by setting up or by creating this very infrastructure, we would never be taken aback when such sort of a disease strikes us against. Now, besides this, the government has taken many other initiatives as such, and this is not just one initiative, such as the Pradhanmantri Jan Arogya Yojana, that is the PMJ, or the Ayushman Bharat mission. So, Ayushman Bharat mission was later renamed as Pradhanmantri Jan Arogya Yojana. Then we have the Ayushman Bharat digital mission. I have explained this in another video of GS Booster Short. You can have reference to that also. And then we have the Prime Minister Pradhanmantri Bharatiya Jan Aushadhi Pariyojana. This deals with facilitating access to generic medicines to people. National Health Authority has been created. So, National Health Authority is having the mandate so as to implement Pradhanmantri Jan Arogya Yojana as well as Ayushman Bharat digital mission. Let us have a cursory look at all these initiatives. First of all, we have the National Health Mission. So, National Health Mission is basically, the term has been integrated by integrating National Rural Health Mission and National Urban Health Mission. So, under National Health Mission, there is basically provision for strengthening infrastructure, human resource, drugs, equipments, ambulances, ASHA system, etc. It is also basically geared towards controlling communicable diseases and non-communicable diseases also, and with respect to the same, infrastructure maintenance to support salary of A&M and LHV, etc. So, basically through this very mission, a holistic development of the health sector has been envisioned both in urban and rural sectors. The other missions are basically there to supplement it. The most important being of them is Ayushman Bharat digital mission. So, Ayushman Bharat digital mission was also recently launched. Now, what does this mission provide? So, main aim of this mission is to actually facilitate the experience of patients in hospital by creating a unique health ID. The information with respect to a patient can be easily accessed and transferred between insurance companies and different hospitals. All the basically government hospitals will be coming on this very portal, and there is also provision for private hospitals and healthcare facilities to enroll themselves on this very portal also. Besides this, this very portal will also be having a repository, a registry of digital healthcare professionals and basically services. So, healthcare professionals can also basically create ID on this very portal. This portal is going to actually verify their identity and their credentials. Besides this, various healthcare facilities and hospitals can also register themselves on this very portal. This will help us in order to identify wherever the closest healthcare facility is, and in this very manner a patient would not have to basically spend valuable time in finding healthcare professionals around him. This would also help in saving individuals from quacks. Basically, there are a lot of practitioners in the country today which do not have valid degrees, and it is difficult to identify today the valid practitioners from the quacks. So, in this very respect, Ayushman Bharat digital mission is also going to help us. Then we have Pradhanmantri Jan Aushadhi Pariyojana. Now, there is a lot of out of pocket expenditure on basically drugs, that is medicines, after an individual goes for a treatment to a doctor. So, through this very mission, the Prime Minister's Pradhanmantri Jan Aushadhi Pariyojana basically mandates opening up of Jan Aushadhi Kendras, in which generic medicines of good quality equivalent to those that we get from private institutions would be supplied at low costs, and in this very manner it would reduce an individual's out of pocket expenditure. Then we have the PMJ, that is Pradhanmantri Jan Arogya Yojana. Now it was also referred to as Ayushman Bharat mission. Under this very mission, first of all, health and wellness centers were to be established. So in February 2018, the scheme aimed to provide extensive healthcare services to citizens closer to their home by establishing 1,50,000 health and wellness centers. So over here that we are seeing is that now the model has been emphasizing on bottom to up approach. In whichsoever countries where we have found that public health system has performed well, we find that primary healthcare infrastructure in those countries has been extremely good. However, until now, until few years back, the major focus in our country was with respect to creating secondary and tertiary care facilities. Primary healthcare facilities were generally left with the states. However, now the entire focus has been shifted to strengthening primary healthcare infrastructure towards nibbling the disease right from its very start. Only and only then can we prevent large scale health problems from occurring. Then under Pradhanmantri Jan Arogya Yojana, now this very scheme is a unique scheme. Why do I say it's a unique scheme? Because it actually aims towards enhancing the potential of the private sector. Given our population, it would be unrealistic to think that only and only government can provide entirely for the entire population. However, under Pradhan Mantri Jan Arogya Yojana, every family, there are about, not every family, the underprivileged families, roughly about 10 crore families covering about more than 50 crore population of this country would be provided with 5 lakh rupees cover of insurance. This would also cover post care services, post hospitalization services also, and every individual would be capable of taking benefit of this very insurance in impaneled private hospitals and government hospitals as well. And various packages have been created, and those hospitals who want to come on this very panel, they can actually join in. In this very manner, a systematic approach is being adopted towards giving healthcare insurance services to the entire population, and it would also bringing many affordable care private institutions on board. So then lastly we have National Health Authority. So National Health Authority has been created, as I have already told you, with the mandate of implementing Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana and National Digital Health Mission. So it is under the mandate of National Health Authority so as to implement these two programs. Now, one thing that we have to note, that Pradhan Mantri Bharatiya Jan Aushadhi Yojana is not under the Ministry of Health. It is your job now to find which is the nodal ministry for implementing this very pariyojana. So over here we have understood how holistically a number of schemes have been created, a number of missions are being implemented so as to strengthen the public health care infrastructure and to prepare it for future challenges. So in times of stress, in times of challenge, it is always better to learn from them and act upon, so that in future when such challenges come again, we are not taken aback. So that would be all from my side for today's lecture. Should you have any doubts, feel free to put your doubts in the comment section. I'd be more than happy to reply to those. Thank you and have a nice day.